Good morning, everyone. My name is Chris Buddle, Associate Provost at McGill here, and as you know, very involved with a lot of the COVID response here at the university. Today I wanted to share with you a series of interviews I've done with many members of the community to talk a little bit around what the return to campus is going to look like, which is coming up in the near future. We'll review some key messages related to safety and well-being, and talk a little bit with people about what it means to come back to in-person teaching for many activities in January, and also talk a little bit around how people are feeling and how we navigate these tensions between having a pandemic that's ongoing and the prioritization of education and why it's important. So thanks very much for listening. Hope to see you on campus soon, and hope you enjoy the video interviews we're going to do now. Take care.
I'm very pleased to be joined by our Provost and Vice-Principal academic, Christopher Mandfredi. Professor Mandfredi, thank you for joining us today to answer a few questions as we enter this next phase of the pandemic management at McGill.
Thanks a lot, Chris. Thanks for the invitation. Happy to be here with you.
So I guess the first question I have is, I think one that's on a lot of people's mind, and that is, look, we're in this fifth wave of the pandemic, and some people are just saying, why don't we just stay online for the rest of the term or for a much longer period of time? And what's your response to that kind of question?
I guess I'd start by recognizing that, of course, McGill University is an in-person university. For the most part, our courses and programs are designed to be delivered in person, with the exception of those programs that were specifically designed to be delivered online. The McGill education is, of course, not just something that happens in the classroom. It happens in the interactions between students, and their professors, between students, professors, and staff as they interact with each other in person. Being online, of course, was kind of an emergency stopgap measure that we had to undertake as the pandemic was very serious, beginning in March 2020 and through all of the last academic year. But as we ramped up the vaccination rates, as we saw the effectiveness of the vaccinations early on, as we put in place other measures such as masking requirements and increased ventilation in our buildings, it became obvious that we had the tools to let us return to that in-person academic experience. I think that's the most valuable experience that students have. I hear from many students who want to be back in person. They enjoyed last fall when we were back in person. And I think if you look back at many of the, I would say, dire predictions about what would happen in the fall, very few of those came true, if any. We had a very successful in-person fall experience, so we have empirical evidence about our ability to operate in person under COVID-19 conditions, even as those conditions change.
I guess one of the points of tension actually comes from the fact that we're still under these government restrictions in Quebec. And we have to, there's of course the need to protect the healthcare system. And then at the same time, people are saying, well, how can we do that if education is going back? And so that dichotomy, I think, creates a little bit of tension, or some people see it as a paradox. I wonder if you could speak a little to that particular paradox that some are pointing to.
Yeah, I can understand that completely. You know, people say I can't go to a restaurant, but I can for some reason go to my class at McGill, and I can see why that's a paradox. And I think the answer to that is quite simple: is that two reasons really. One is the government has made education at all levels a priority for reopening. So it's decided that education, and I think it's correct in that decision, is that sector of society that is going to open first. And the other sectors of society can open later as things improve even more. And the other reason I think, particularly for universities, is that the evidence from last fall, this is hard data from last fall, is that universities were an extremely safe environment under the pandemic conditions. There were almost no outbreaks at universities. Case counts were low. We have among the highest vaccinated populations in the province among our students and staff.
I guess I have one more quick question for you. Some people really are scared and have a lot of concerns about coming back. And what's your message to people who are afraid to come back in person?
Well, look, I understand that people have different personal circumstances that may make their risk higher, and I can see that they'd they will have even greater concerns, and those concerns are legitimate. I think my message to them would be that the university is putting in place all of the measures necessary to reduce the risk to the lowest possible level, that we are putting in place accommodation measures for those where even that low level of risk is still something of concern. I would also like to say that what we've built into our return to campus this winter is a great deal of flexibility. I like to use the analogy of a dimmer switch in other contexts, and I think that's what we're talking about here. We're not going to lights on, lights off situation where we were never on campus and then we're turning the light on and everybody's back full in campus as if there was nothing going on. Instructors have the flexibility of delivering up to 20% of their courses online throughout this term. That was something that Senate agreed to in the fall, and that I think will allow a very comfortable on-ramp for many instructors and many students as we come back in the current context.
That's a great answer. Thank you very much, Provost Mandfredi. I appreciate you taking time with us today. So I'm really pleased to introduce Valérie Orstat, who's a professor in the Department of Bioresource Engineering at Macdonald campus and currently Associate Dean of Student Affairs at Mac campus. What's kind of the mood on campus then when you talk to people, whether it's students or colleagues or instructors, about this return? And I know that there's different perspectives on it, but I'd love to hear your thoughts on that.
I think that there's like a duality of feelings where some people are still a bit afraid and some people are just very eager to get back in the lab and see the students, and the students equally are feeling a little bit, unsure of how it's going to be, and the wearing a mask all the time, and even instructors wearing a mask all the time is sometimes not as pleasant in terms of returning. But we know we must come back to be able to provide that comes to our students.
I know you also have students living in Laird Hall, of course, and you probably see them walking around campus and in the building. Are they looking forward to, again, there's probably a little bit of apprehension, but are they eager to get back in the classroom overall, would you say?
Yeah, I think they're probably the ones most eager to get back in the classroom so that they could get out of their residence room. I'm not sure if it's apprehension. It's just that they're not too sure of how it's going to go about, if it's going to be stricter or if we should be more careful, because everybody says, oh, well, Omicron has been so contagious. So how are we going to do reassuring to everybody that the wearing of the mask and as much as possible maintaining distancing, especially around lunchtime where you have to make sure you maintain that. But at the end, I think everybody's going to benefit for being back in person, just for the social interaction. I think many of our students are missing those social interactions.
Yeah, I think that's a fair point, and it's often not even as much the sort of formal lecture material as the kind of informal learning that happens in classrooms and also in other parts of the campus. So, Valérie, thanks so much for taking a few minutes today.
My pleasure.
I really appreciate the perspectives. Okay, I'm very pleased now to have an opportunity to chat with David Eidelman, who's our Dean in the Faculty of Medicine and Health Sciences and our Vice-Principal of Health Affairs. So thank you very much for the time today. My first question really is about the fact that you have such great insights into the healthcare sector, which we know is under immense strain right now, but you also understand that we are a university that has many other kinds of programs and other kinds of disciplines. And I guess my real question is, what's your perspective on this return to campus, and should McGill be returning to in-person teaching activities across most of its programs in the coming days?
So I think it's a big challenge that we're facing right now in the pandemic and a fifth wave. The good news is, at least from the numbers I saw today, things are starting to look a bit better. I feel strongly that students need to come back to campus to the extent that's possible, because I think there's more than one risk. there's certainly a risk of COVID, and there's, when COVID is already spreading throughout the community, whether you go to campus or not, there's a risk of catching COVID. That is just a reality. And that's why everybody needs to be vaccinated. We know that when people are vaccinated, especially if they have the third dose, that this really reduces the likelihood of people developing severe complications, of ending up in hospital. And with the third dose, actually reduces the number of infections. Does it solve the problem? It does not. But we have to go on because there are other risks for learners. First of all, we want to make sure that they have the best education possible. And that's, in my view, not entirely possible with a pure online kind of education. I think there are mental health issues that are important, especially for young people who at this time in their life should be hanging out with other young people and going to class and doing things. I know we can't do everything we want to do. I know it's not perfectly normal, but it's a heck of a lot better than being locked in a dorm room or an apartment by yourself or with your cat or something for 8 hours a day. It's just not very good for people. And I think that when we consider the risks of COVID, we also have to consider, on the other hand, the risks of perpetual isolation. I just don't think that's a negligible risk to people. On the other hand, we have students and we have residents who are spending their times in the hospitals, and they're in a very different situation. Of course, they are, in a community, they can also get COVID, but we've been trying to, the hospitals are taking extra precautions beyond what we would take, what I would take myself when I go to the grocery store or I go for whatever. They're taking extra precautions, not so much because they're at higher risk, but more because we can't afford to lose any of our healthcare professionals, including our learners. So, today's student is tomorrow's health professional, and we have to make sure they graduate on time. We have a shortage of health professionals, so we're working extra hard. So I think the answer about coming back in person depends a lot on which program you're talking about. But I think for most programs, people do need to be back in person, at least for most of what they're doing. I think for health professional students, most of them have been back in person since perhaps May of 2020. They've never really stopped having in-person learning. But on the other hand, they need different arrangements for how that's done. We have to replicate what goes on in the hospital. We have to replicate it on campus. So I think a lot of it depends on the learner's situation. I think the same thing applies to professors. We have professors, for instance, in nursing, who are part of the healthcare system. They're employees of the Ministry of Health. The pressure on them and the constraints on them are quite different than, let's say, someone like me or a professor in math or in pharmacology or whatever. So it's a difficult time now, and I think the best way to look at it is we have to get as many people on campus safely that we can. We have to do it with caution because things can change in the middle of a pandemic. We've learned that. But at a certain point, you have to get people back on campus. And certainly the learners I've spoken to, they all want to be back on campus, and I think it's a priority. And I think that compared to hanging out, with your friends socially, the risk is no more, or it's probably less, frankly. When people get together and they start having a meal and so on, most of the transmission that I know about, at least in my very anecdotal, non-scientific review, takes place on a social level, not so much in a professional level, not in the grocery store, not in class. It's getting together with folks. But when you talk to the people who work in the ICU, who see the very sick people, about half of them are non-vaccinated, so that's really a risky thing. And some of them are very elderly, they're at risk because they have immunocompromised. Occasionally, unfortunately, perfectly healthy people are still susceptible. It does happen, but that happens even in normal years where we don't know why some people get sick. Statistically, though, people who are vaccinated are very much reduced risk of having severe disease. And we know from looking elsewhere that people can go about their business under these conditions, especially if they take reasonable precautions, like wearing masks, like restricting activities to ones which are essential and not and avoiding social activities that are at a higher risk. That's going to reduce the number of cases dramatically. Will we do as well as we did in the fall with the Delta variant? I don't think we will, just because this variant is more infectious. But will it be a major problem where we can't cope? I don't think so. I think people are going to find that it's going to go well. We're going to have to monitor the situation very carefully, because if it does turn out that I'm wrong, we need to intervene and adjust accordingly. I can say that in the hospitals, there have been very few outbreaks caused by among protected staff where people are taking reasonable precautions. Is it perfect? No. So I think we're also in a period of the pandemic where the cost of restricting our behavior is starting to be higher than the risk of potentially getting sick for many people. Not for everybody, not for people who are immunocompromised, not for people who have very special conditions, but not for very elderly people either. But for young people who are in good health, the risk of social isolation is not trivial, and mental health issues are real. And the importance of getting a good education is a lifelong impact. And you don't want to compromise your educational advantage for a whole lifetime unnecessarily. So, I think we're at a point in the pandemic where we need to balance risks and not only talk about the risk of the infection, which is very important, but also talk about the risk of not doing things as well as the risk of doing things.
So, David, thank you so much for the time today. Really valuable insights. We appreciate it. I'm very pleased now to introduce Professor Shauna Van Praagh from the Faculty of Law. It's really nice to have you here today. I look forward to chatting a little bit about what the return to more in-person teaching activities look from your perspective.
I think it's hard for all of us to articulate what is so precious about shared time and shared space in teaching and learning. But a student last year actually helped me out a lot in terms of that articulation. And that student who was going through the entire year on Zoom at one point said to me, "You know what I miss? I miss shared laughter in the classroom." And it hadn't even occurred to me that that was something that we were missing. But I thought that that was really insightful. And it's not that every classroom is a moment of joy and humor. It's not that. It's the sense of sharing one's reactions, knowing that if you're frustrated or confused, that the people around you are also feeling that, or you can kind of, you sense that as a group, as a collective, the professor gets that, and that there's some real opportunity for expressing those shared experiences and reactions as you learn together.
How do you kind of bring perspective to that, and how do you balance those issues as an instructor at the university?
I think that we move forward with care and with caution, and also I think most importantly with compassion for each other and for understanding that we need to listen to each other and where appropriate and where necessary, make sure that we're supporting individuals for whom kind of coming back to campus, they may really want to do that, but they may have good reasons for being very nervous about that. And so that I don't think it's an either or. I think that we can actually move forward, care collectively about education, and also make sure that we support each other.
That was lovely. And that idea of using kindness and compassion as guiding principles in the face of uncertainty and difficulty is so very, very important. So thank you so much for sharing those very insightful and thoughtful comments, Sean. I really, really appreciate it. Elyass, actually, why don't you introduce yourself and tell us what program you're in? That would be the first order of business.
Yeah, for sure. So I'm actually a third-year student. I'm double majoring in statistics and psychology. And I'm also a student, like wellness. I work at the Wellness Hub as a student hub supporter. So I'm a student and I also work here.
And I wonder if you could tell me a little bit about what you've been hearing from other students and what the vibe is around that more return to more in-person activities that's coming up.
Yeah, like I know a lot of people are very excited about it, There's definitely a shift. I know, like, especially at McGill, there's like a lot more diversity in like what people want. Like there's some people that like really want an online option because of like some health reasons or because it's more convenient for them. But there's also a lot of people like that really miss that like in-person activity. So there's definitely a lot of frustration. Like starting the semester online was very like hard for me. Like the first week, I barely did anything in my courses. Like I was just like letting the recordings pile up a little bit, and like now I'm back into it. Especially since we have a date when we go back in person. I'm very excited about that.
So, what is it about in person that you particularly like or find valuable?
I mean, for me personally, I really like have to have like a space for studying and school that is very separated from like everything else. Like I do a lot of things in my like I have a studio, so like it's like one big room, and like the same place that I study and that I sleep and that I make food, and, like I have like friends over usually. Like it's just there's like too much distraction, and like I perform best when like I go to the library and like I'm there for 3 hours and I'm done with all my stuff and I come back. But like it's harder to keep that schedule when it's online.
Elyass, thank you so much for your perspectives. I really valued what you had to offer, and I think it'll bring a nice perspective. I'm very pleased today to also have a chance to speak with Nancy Czemmel, who's a manager of student services in the Schulich School of Music. And I'm really looking forward to hearing a little bit of the perspectives that you're going to bring to this conversation. What are you hearing in the Schulich School of Music, but from maybe colleagues or students or in general? I'd love to hear your perspective as a staff member, but also just generally what's the vibe within the School of Music.
So I've heard from a number of individuals, who've expressed concerns and some reticence to returning to the campus. I think people continue to have, real genuine concerns about health and safety and just the overall work environment about returning to campus. I've also heard, from a number of individuals, about, after months of isolation, that they'd like to return to the office, and I can honestly say I'm probably one of those individuals. I'd like to get back as soon as possible, provided it's safe and there's a safe environment. And I also know that where possible, for those individuals who for whatever reason may be uncomfortable or have family situations and so are a little bit more reluctant to coming onto campus, we've been able to work with them and provide them with a somewhat flexible schedule where possible. And I think in most cases that has been really greatly appreciated. I think we all know that there needs to be a sense of flexibility. And if absenteeism, can't be avoided due to, Omicron and whatever that may be, I know within music, we've talked about it, we've had discussions, we've put in protocols, and I think we've put in place for students, who feel that they may not be able to attend their ensembles, that they can reach out and let us know. We have a protocol in place. They won't be penalized. And, we're not going to be pushing for medical documentation that if they feel, they're exhibiting COVID-related symptoms, that we're there for them and their support.
The way we think about flexibility and support are so central to helping people who are concerned about coming back to campus, recognizing that there are ways that the university is flexible, whether you're a staff member, whether you're a student, and there are also ways that you can be accommodated or you can have those conversations to find ways to be supported. Many of the students that have been in the performance area, for example, have been engaged with their in-person activities throughout the whole pandemic, and so it must be I guess I'm kind of curious about what sort of stories you have or what kind of experiences you can share that really reflect how the Schulich School of Music has been really doing a great deal of in-person activities, even when many of the rest of us have not been on campus.
I think the school has been a leader in adapting to the COVID environment. They've done the pedagogical shift. And they've managed any kind of apprehension there may have been, both faculty and students. There have been instances where, our communications and production group, for instance, they put on the concerts and events and they really have had to adapt, and they've done a great job in order to bring the concerts to us, and they're eager to get back to those. To play music and to play it together, to perform in front of an audience is so central to the student experience, to the staff and faculty. It's why we're here. And so to do that, you have to be in person. And if the students are on campus, then I mean, for myself, then there's a sense that I should be on campus as well, and be able to be there for them and support them. And if they need to drop in, or make an appointment, that they can do that.
Thanks, Nancy. Any last thoughts? This was great. You really hit on some really valuable points I don't think we've captured in any of the interviews yet.
Thank you. No, I think, just like you said, it's important to be safe and to get back at it.
Yeah. And also be honest that it's scary. I mean, that also is, we can't say it's not, because it is for many people.
It is.
And so that's important. Yeah.
Yeah, it's very real.
For sure. So I now have an opportunity to chat with Fabrice Labeau, who's our Deputy Provost of Student Life and Learning, and as all of you know, sender of emails about the pandemic and very active in the pandemic response at the university. So Fabrice, my first question for you really is to reflect back on the fall semester. How did it go in the fall overall?
I think overall it went well. I mean, it was a challenging semester because of the of COVID, of course. But if we look back at the data we have for the semester, we typically had upwards of 25,000 people on campus every day, upwards of 10,000 people in our libraries every day. And if we look at the number of cases we've had on campus, it's remained limited. It's followed the trends at the provincial level. But despite that, despite us seeing cases on our campus, we've seen no transmission in our classroom settings. So it's an important thing to realize that thanks to the layers of safety we have put in place in the fall, some people came to campus not knowing they were positive, and it turned out to have been positive and contagious on campus. But because of all these layers we have, they did not transmit the virus to others on campus. So overall, I think despite all the anxiety that a lot of people had at the beginning of the fall semester around uncertainties related to the pandemic, it went really well. Overall, I think it was a success. As Omicron was starting to gain momentum towards the end of the fall semester, we have a bit of data on the impact it had on our settings. And so towards the end of the fall final exam period, it was the dominant variant in Montreal. So we had cases in our exam rooms, which were Omicron cases. And again, in that case, thanks to the layers of protection we had in place, there was no transmission in these exam rooms. So it is positive in terms of the outlook for our management of Omicron also. Omicron is different, and we've seen it also in the way the public health directives have been changing around the way to manage it. You know that we've seen changes in the way case management is done throughout the province, and we've of course adapted to that because we've been following public health directives in terms of case management. So it's now up to the individual who tests positive to warn their significant contacts of the fact that they tested positive. The isolation periods have changed also, so they've now been shortened. For most people, it's going to be 5 days instead of 10. On campus, we're still trying to track positive cases. So we realize that despite the fact that now the testing in the province is not something that happens in a systematic way in PCR testing centers, we still want to have a sense of how many people test positive on our campuses. So we ask people who test positive or who are deemed positive to still call our case management group. This allows us to keep track of the volume of cases overall, but also gives us an indication of a potential of an outbreak. So finding out where hotspots may be and where cases may be happening in a cluster, which leads us to investigating a potential outbreak.
Now, we know, of course, about the return of the academic activities. Some Tier 1 activities have been happening since the start of the semester, and generally all other academic activities will soon be starting. Can you speak about administrative and support staff and what they might expect around a return to campus? Because there's some very important differences there we need to make clear.
Well, a lot of our administrative and support staff, they're already on campus. So we have people working in student services, in facilities, residences, libraries to run our study hubs, etc. As our classes resume in person on January 24th, there's going to be more administrative and support staff that will be coming back to directly support those academic activities. What we're doing is we're bringing people back very gradually. We're following government directives, and we're definitely prioritizing our academic activities first and foremost. So that's going to be the way people are going to come back to campus, is really to support these academic activities that restart on the 24th.
What are critical things people need to know when they do return to campus in the very near future?
I think our messages haven't changed much since last semester. They're adapted to the new reality, but they're at a super high level. Stay home if you are sick. That's number one. First thing you have to do before coming to campus is to wonder whether or not you have symptoms. You have symptoms, you stay home. When you're on campus, wear your mask appropriately and make sure you change your mask every 4 hours. If you haven't done that yet, get your booster. So that is also one of the key messages. We've had that message in the past to make sure people got 2 doses of vaccines. Now we're at the level where it's going to be required to have 3 doses. So as soon as possible, when you're eligible, get an appointment or get to a walk-in clinic downtown to get your booster, because that's also our path to a safer winter semester. In terms of the masks, also I mentioned they have to be worn properly, so over the mouth and nose. Change them every 4 hours. There's also the possibility of double masking if this is something that makes you feel safer. Also add a couple of reminders here. Instructors have to wear their masks all the time, including while teaching. And staff cannot remove their masks even if they are seated 2 meters away from someone else. So the only possibility when staff will remove their masks is if they're alone in a closed room.
That reminds me of the point that if people are feeling unwell, we do have accommodation processes in place, and both for instructors and for students. So again, the website has lots of information, and there's information that's gone out to the community this week as well to talk about accommodations in place. So I want to thank you very, very much for the time today, and we'll see you soon.
Thank you.
I'm very pleased now to have a moment to chat with Professor Levy, Jacob Levy, the chair of the Department of Political Science and Tomlinson Professor of Political Theory. So welcome, and thanks so much for taking a bit of time to chat today. When you think of your discipline generally, what is it that the in-classroom experience brings?
I don't know that I have anything that's very distinctive to political science, so much as to say in liberal arts classes, which are going to be a different kind of beast from lab science classes. In liberal arts classes, we have two substantial modes of instruction, the lecture and the seminar classroom, seminar discussion, and neither of them works nearly as satisfyingly remotely. In a lecture, the inability of the faculty and the students to have real-time communication through facial expressions, through recognizing moments when, oh, that idea hasn't seemed to make sense yet. Oh, I'm sensing that people in the room need to stop and take some time on this point. The emotional coldness and sterility of the Zoom screen, even if people have their cameras on, just stands in the way of what's genuinely a kind of give and take format, even in the lecture. I had a graduate seminar last semester as my return to in-person teaching, and it was one of my favorite classes that I've ever taught, and the energy that the students brought into it out of their enthusiasm for being back in the room, live and in person, was just wonderful. And as good as the work people have done over the last couple of years has been, it doesn't compare. And I very much hope that we're all safely back together very soon.
I hope so too. Thanks very much. Well, thanks very much for taking a bit of time today. I really wanted to bring in some student perspectives in terms of how the university is looking to the return to more in-person teaching activities coming up later in January. So I guess my first question for you is sort of what's the vibe? What are you hearing with other students, and how are people feeling about how the current term is going, and especially as we look to the coming weeks?
Honestly, it's been pretty rough. I think generally, in my personal experience and hearing from friends and stuff, it's been very just head first into the semester and very difficult, kind of from all perspectives, be that professionally, academically, socially. And I think a lot of people are feeling very isolated. Evidently, that comes along with being in a pandemic, but in a way that I think a lot of people were not expecting it to be. And kind of, I think last semester kind of set this standard and expectation for us that, oh, okay, well, that was better than like the year before that. So I think kind of coming back from that was very difficult for a lot of people.
And you mean you're in a program that obviously has been in person a lot in terms of many parts of the learning that you've done. I wonder if you could speak a little bit around, obviously there are things about online learning that work very well, but I wanted to also get a perspective of the value of the in-person experiences with respect to the teaching and learning context at the university. Can you talk a little bit around what that means to you in terms of your learning?
Yeah, of course. It's definitely been really valuable. I've really appreciated having the opportunity to still be able to have clinical experience. Last year and last semester, I had lab courses on campus as well. I'm not doing that this semester anymore, but I am still doing my clinical, and it's nice to still have that aspect, especially because it's such a huge part of nursing. And, it's very, I can't even conceptualize an education in nursing that wouldn't have that aspect to it. That being said, it's been difficult to kind of balance the in-person learning expectations with online learning expectations. It is definitely beneficial, and to having those interaction in person to kind of strengthen like what we're learning online and to kind of, bring it all together. But at the same time, there has been a lot of anxiety when it comes to being in person, and we've had a lot of COVID scares, and all of a sudden a lot of like questions of, oh, what does this mean for the course? And that's led to a lot of uncertainty as well, which has, there's anxiety on both ends, I think.
Nalys, thank you so much for taking a bit of time with me today. I really appreciate the insights that you brought. Well, Sharvani, thank you for being here today. I wonder if you could just introduce yourself and tell us what program you're in.
Yes, so my name is Sharvani Ram. I am currently in U3. I am studying concurrent food science and nutritional science at Macdonald campus.
Wonderful. Well, again, thanks for being here. I just have a couple really quick questions from you. We're hoping to get a student perspective on what it means to learn in person, and as we look to the coming weeks, how are you feeling about the next little sort of stage of this pandemic experience at McGill in terms of more of a return to more in-person activities?
Definitely mixed feelings. Obviously, online learning will never be able to fully, will not be able to fully like replace in-person learning. Like you will never get the same experience. No matter if you try to have your cameras on, like it's not the same as sitting in one room and like listening to your professor at the front of the lecture room. And it's really nice to be able to connect to students. I know like community, like having a sense of community is really big for McGill, especially at Mac, considering we're a smaller campus. Like it's so nice to be able to walk in, like, walk through the hallways and like say hi to your friends. And even in like classrooms, it's so much easier to connect with others. Whereas like, I know that online, it can be quite a barrier. However, there are so many advantages to being online. Like having that online learning, it becomes so much easier for me to keep up with stuff. Because like, just a little background, like I'm also an OSD student. So when I was at Mac and when lectures weren't recorded, for instance, like I had to rely on a note taker if I even had a note taker, because not every class I was guaranteed to get one. So the thing that I loved about online was having that recordings as well. So I can go back to lectures and, fill in the information that I missed, which was really great.
I totally understand that there's a anxiety and worry, but also excitement because there's value to in-person. But really, for your learning, it's a balance of the two is something that works really well. So this was just really, really nice to get your perspectives, and I really appreciate you taking just a couple of minutes to chat today. So I'm so pleased right now to introduce our Principal and Vice-Chancellor, Suzanne Fortier, who is going to take a few minutes to finish off our video interviews. So I guess my first question for you, first of all, thank you for being here. My first question is, how are you feeling about the weeks ahead as we look to a more robust return to in-person teaching activities?
Well, I must say I'm really happy to think about our campuses being much more full of activities, and particularly seeing students back on campus. So I'm feeling very good about that. I know, of course, that we have to and we will remain very prudent. We still have a lot of viruses around, but we've learned a lot in the fall term, and we've learned how to live with the virus to some degree. And we've learned also how to monitor the situation very, very closely and adapt and add some measures if we need to. So I'm feeling confident that we can be back, and we can be back safely.
You always have such important and impactful words for our community as well. And I wonder what sort of principles that you rely on to guide your decision making, your approach to the pandemic, and how you might take those principles and have advice for members of our community when they are feeling a little bit anxious about the return.
Yes, so first thing I would say, and this is something we said right from the beginning, what's important to us is to keep our community safe, and also to provide the best learning environment we can for our students and our researchers. So this is what drives us. These two goals, very important goals. Now, of course, after nearly 2 years now of living with this virus and with uncertainty, it's clear that it's testing us, it's testing our resilience, our nerves, our patience. But we have to remember that as a community, what we can do best for each other is to remain calm, to remain kind to one another, and also to look out for each other, to be there to support one another. This is so important. And I would say to members of our community, it's quite possible that each one of us at one point will have a low moment, maybe feel tired of the situation, even depressed. So it's very important that we take care of ourselves as well. And when we feel that way, that we know there are people out there who will be there to support us and uplift us. So let's think of ourselves as a real community that can help each other throughout this crisis. There's still uncertainty. We still have to live with that. But through all that we've learned, I think that we know now with greater confidence that we can navigate a world with some remaining viruses like COVID. And hopefully that will serve us well, not only for today, but for the long-term future.
That's wonderful. Yes, we have to look back to see what we've learned, and then also look forward and take the step forward as well. So Principal Fortier, thank you so much for your time today. I really appreciate your perspectives, and I look forward to seeing you on campus.
Merci beaucoup. And I hope that next time we see each other, there will be a full sunny sky behind you in the background.
Absolutely.
Hi, everyone. Thanks very much for watching the videos. I hope it was helpful to you. You got to hear some of the perspectives from different members of our community, some of the safety measures we have in place. And I hope it's also an opportunity to reflect on some different perspectives and how we can ensure that we come back to more in-person teaching activities in a way that's safe, and also achieving our academic mission and make sure that our students get the best kind of education that they want and that we want to give them. Stay well, everyone, and we'll see you again soon.